I am Dr. Amanda Tinsley, a board-certified headache specialist and neurologist at MedStar Georgetown University Hospital. I treat adult patients with neurological conditions, and I specialize in headache disorders. So I have adult patients that are young adults, old adults, and everything in between, from all walks of life and all backgrounds. Because migraine is the most common primary headache disorder, and migraine is 3 times more common in women, the majority of my patients are women, but migraine is also very common in men as well. So 6% of men have migraine. So I approach patients with compassion and dignity as if they were my own family member. And when it comes to headaches, there's really 2 ways that I approach headache medicine. One way is offering patients the tools when they're having a migraine attack, a medication they can reach for in that moment to really break the pain and restore their function so they can go back to doing what they need to do that day. The other side of treating migraine is to prevent the headaches in the first place. And so to do that, we focus on nonpharmacologic therapies like lifestyle modifications, getting good sleep, reducing your stress levels, that's a big one, staying hydrated, limiting caffeine and alcohol intake, good healthy living, and then also scheduled therapies that patients take to try to prevent the overall headache burden. I decided on headache medicine because I'm very passionate about it, and it's really an unmet need in the neurology space. We have a shortage of neurologists. Headache is very common. There's even more so of a shortage of headache specialists. So I kind of saw it as this unmet need and an opportunity to make an impact on the lives of those living with migraine or and other headache disorders. It's a very exciting time for headache medicine. Probably the most exciting is in the area of migraine. We're starting to understand more what causes migraine, what's actually happening on the molecular level during an attack, and this has led to more tailored, targeted therapies for migraine. So since 2018, we have a whole new slew of migraine treatments that are very effective without a lot of side effects. My favorite part of my job is when I can take patients off of medication. So often when I meet patients, they're miserable, they're having frequent headache attacks that really impact their quality of life. And so, we work together to develop a treatment regimen that works for that patient. And I always want to give patients the tools to handle a migraine attack when it happens so that it doesn't interfere with their life and their work and their joy. And so I always want to give patients an acute therapy so they can reach for. But as far as a preventive scheduled therapy, if patients are doing really well, I love to be able to take them off of that down the road. So that's really satisfying when we get to that point. MedStar Georgetown Headache Center is very unique and special because it is the largest academic headache center in the DMV area. All of the physicians are board certified in headache medicine, meaning that we've undergone rigorous training in the field, and we are aware of all the complexities of treating headache disorders, and we use evidence-based therapies that have been shown to be effective. We also do clinical research to better our understanding of headache disorders and develop new and improved treatments. There are so many things I love about my job, but probably my favorite part is when my patients do well. So it's really fantastic when I meet someone and they're miserable with their migraines to kind of go on this journey with them and see their headache disorder evolve and over time improve, and then one day they don't need all of their medication. Comorbidity is defined as 2 or more medical conditions that occur together. So for example, patients with migraine are twice as likely to have vitamin D deficiency. So vitamin D deficiency is considered a comorbidity of migraine. There are many conditions that are comorbid with migraine. You have cardiovascular conditions such as stroke and heart attack, psychiatric conditions like panic attacks, depression, anxiety, other neurological diseases like epilepsy. Sleep disorders is a common one, insomnia, sleep apnea, restless leg syndrome. inflammatory conditions like rheumatoid arthritis, asthma, allergies, and then other chronic pain syndromes as well, like fibromyalgia. So some patients have a comorbid condition with their migraine, and some patients don't. Comorbidities are very common with migraine, and many patients will experience at least one comorbidity in their lifetime. As the headache frequency and the intensity of the pain attacks increases, the risk of comorbidities increases as well. So for example, a patient that has episodic migraine, meaning fewer than 15 days of headache monthly, has about a 20% chance of having depression. But a patient that has chronic migraine, meaning 15 days or more per month of headache, then that risk shoots up to 30 to 50% of having depression. It's important to recognize comorbid health conditions with migraine because having a comorbidity can impact the treatment of migraine. It can limit the options that we have. Patients also may be on different medications for their other health conditions that could potentially interact with migraine therapies. That's a consideration we have to think about. Also, it can help with prognosis. So we know that patients that have migraine and depression, if their depression worsens, then they're at risk for progression of their migraine disorder. It's important to consider the comorbid condition with migraine when it comes to management because it can impact the diagnosis and the treatment for that patient. For example, if a patient has sleep apnea, that can lead to headaches. So if a patient has both sleep apnea and migraine and they're having a worsening of their headache disorder, you have to make sure that both their sleep apnea is well controlled and their migraine is controlled as well. So that can make it a little bit harder to figure out what's making the headaches worse. Is it the sleep apnea? Is it the migraine? As far as treatment goes, there are some limitations to the medications we can use in certain comorbid conditions. For example, we often use triptans, a drug class that was designed for acute migraine treatment, but that could be dangerous in a patient that has comorbid cardiovascular disease. So we need to take that into consideration. And then you also have to think about drug-drug interactions because a lot of patients may be on medications to treat their comorbidities, and you have to think about a potential interaction with a migraine therapy that you might consider adding to the patient's regimen. And then the final reason to consider it is for prognostic reasons. So patients that have a worsening of one of their comorbidities can be a risk factor for progression of their migraine disorder. A headache specialist will be thorough and take a detailed medical history in order to uncover any previously diagnosed comorbid health conditions or undiagnosed comorbidities that may impact their migraine management. And if a patient does have a comorbidity, it's important that that is successfully addressed. So sometimes we can treat migraine and a comorbid condition with one single therapy, which is great. Sometimes we need to refer patients to another specialist for further evaluation and treatment of a possible comorbidity. So just like most medical conditions, lifestyle factors play a role in management. And so when it comes to migraine and comorbidities, it's important to get good sleep, good regular sleep, quality sleep. Reduce stress levels, stay hydrated, limit caffeine and alcohol. Those types of lifestyle modifications can be really important in overall health and in the management of migraine. Researchers are still collecting data on the various comorbid conditions that are associated with migraine. There's more research that needs to be done into what actually causes comorbidities. Is this that comorbid conditions and migraine share similar underlying mechanisms? Or is it that one causes the other, or vice versa? is it that the treatment that we use for migraine actually causes complications? For example, some patients may overuse anti-inflammatory medications to treat their migraine attacks and then develop gastric ulcers. And so is gastrointestinal disease comorbid with migraine because of the treatment? So exploring these different pathways will provide insight and clarify what's actually happening in our migraine patients and hopefully lead to improved therapies. So that is a great question for which there is not a simple answer. We still do not fully understand what happens on a molecular level with migraine, although there's been a lot of advances in that area. One hypothesis is that the comorbid conditions share common or overlapping genetic or biological mechanisms with migraine. Another theory is that there's a unidirectional relationship, meaning that one of the conditions actually is causing the other. And a third theory is that they both cause each other. So there's still more research that needs to be done to really fully elicit what's going on with comorbidities and migraine. The MedStar Georgetown Headache Center, we focus on treating the entire patient. Even though we're very passionate about headache medicine, we realize that everything's connected. So we will take a detailed history, we'll be very thorough, and try to uncover any underlying comorbid conditions. Sometimes these have been previously diagnosed, sometimes we're the ones to diagnose them. I can't tell you how many times I've diagnosed sleep apnea when patients come to me with headaches. And we will address these, whether we are able to do them on our own or if we want to call in our colleagues. One of the great things about working at MedStar Georgetown is that we have access to expert services, subspecialists in all these different fields of medicine. The patients self-refer. They can also be referred by their primary care provider or another specialist. The advantage to coming to MedStar Georgetown Headache Center for your headaches is that we are passionate and we are dedicated. We focus on treating your headaches.